Swadikap and good afternoon once again. Today is Wednesday, the 3rd of March, 2021, and this is the English language summary of the daily press briefing here at the Center for COVID Situation Administration, or CCSA, as always. So I'll start off first with the numbers, statistics that we have for today. New confirmed case we have for today is 35 cases. New recoveries, 63. We had the one extra fatality, so very, very sad to announce. That is a Thai male aged 92 years old from Pathum Thani province who suffered a few chronic illnesses, including diabetes, high blood pressure, and heart disease. So our sincere condolences to the family of the deceased. Now, with the 35 cases that we have, new cases, and 63 new recoveries, you can notice on screen that the number of people who have recovered or discharged is almost reaching the number of cumulative cases that we have since last year. 25,000 to 26,000 you see on screen. So doing the math, around 541 active cases still remain, those under treatment. So it's a very good number, although in the hundreds, but it's been very different from the past weeks and months where we had many thousands of people being treated at one particular point in time for active cases. So hoping that this number will lower in due course. So from the briefing of Dr. Thuisin, the spokesperson of CCSA just now, we had many statistics that we saw. One noticeable change is that if you see the map of Thailand that was presented just now, we have less infection cases in many provinces. So, for example, the map that you saw had a more gray-colored and white-colored provinces, which is even better than the green-colored provinces. So, the gray-colored provinces that was shown just now, for example, was a collection of data from the 4th of February to the 3rd of March, around 1 month. And those gray provinces had no infection cases for 28 days, and the number of those gray provinces are 40 provinces. So that's very good news to hear. And you saw the visual in the map just now. Now, just some additional observations. The new wave of COVID remains under control in most areas of the country, and it's actually a positive sign is the continuity of the decline of the new cases in the last few days. So we've seen only 2-digit daily new cases since last week, 2-digit cases only. However, infections are still found in certain areas, such as among those related to fresh markets. We talked a lot about fresh market clusters in Pathum Thani province and in Mesod district in Tak province as well. So therefore, we still advise the public to continue adhering to DMHTT, distancing, mask wearing, hand washing, temperature check, and the Thai Chana Mo Chana contact tracing application. Now, there was one particular case among the cases that we started to vaccinate medical personnel right now. So as the days goes by, there was one particular case that a member of the medical team, the frontline medical team, was sort of like allergic to certain substances, allergic to penicillin as well. So after 3 hours of observation after the vaccination, that individual had some symptoms and is under the care of the medical personnel after the vaccination. Now, the Ministry of Public Health will be providing more information on this particular case later today in the afternoon at 3 p.m. and we'll have more information to report to you in due course on that. But nevertheless, the individual is safe after the vaccination. It's actually been the first time that there had been some sort of reaction from the vaccination that we have been administering since Sunday. Some additional information on the vaccination plan. Yesterday, the 2nd of March 2021, the Director General of the Disease Control Department of the Health Ministry explained that vaccination plan of Thailand has 3 main objectives. The first is to reduce the risk of infections and fatalities, especially among people over 60 years old. Second, to protect the public health system from being overwhelmed. And thirdly, to move the economy and society forward. So the vaccination plan in Thailand is divided into two phases. The first phase is from February to March, which is this period. And during this period, the vaccinations will be distributed to 15 key provinces, priority provinces first. And the target is to inoculate around 500 persons per day at each designated hospital. And the second phase will be from April and May onwards, and we expect to vaccinate people more widely, including expatriates as well. Now, the Secretary General of the Food and Drug Administration of Thailand, or FDA, revealed that more vaccine manufacturers are expected to register their COVID-19 vaccines in Thailand. Now, it's a policy now that Thailand will not be closing off or preventing the arrival or the proposal for other brands of vaccines. So, for instance, Johnson & Johnson had submitted all the documents required already. You see an infographic there on screen. And Bharat Biotech and Moderna are also interested to submit such registration documents. So the research and innovation, the openness to all of these vaccine manufacturers is here in Thailand, open for them to register and be approved by the Thai authorities so that we will have a continuous and ample supply of vaccines in the future, in addition to the vaccination plan that we have already. So today, just let me close by giving some updates. You have heard in the news regarding the vaccine passports, wherein the authorities concerned are currently exploring these possibilities by making some kind of mutual arrangements, perhaps, on vaccine passports with foreign countries which will facilitate travel and business activities. So on our part, in Thailand's part, we are looking very closely into this, exploring and assembling information and planning the proposal for having vaccine passports. So an important factor to be considered is that each country approves vaccine from different producers. So we'll still have to study that and how to have this interplay with each other and standardize with each other for the benefit of travelers coming in to Thailand in the future. And we're aware that many countries around the world are looking into this and in different stages. Some might be in the advanced stage of almost coming up with this passport, this kind of scheme already in certain regions, perhaps in Europe as well, for example. So just to update to you on that. Now, furthermore, on this issue, the National Communicable Disease Control Council will be talking about this in due course next week on the 8th of March 2021, next week. And they'll be considering this matter. This meeting will be chaired by the Minister of Public Health. And any updates and information we have for you on that will be conveyed in due course. So that's all I have for today. Thank you very much for your attention. We'll be providing information on social media as well. As you know, we have the briefings Monday, Wednesday, and Friday, and not on the other days. But nevertheless, you can find information, particularly in English, on the social media and other sources that we have informed you already. So just to recap what we had heard from the Thai language edition from Dr. Tuisin, and thank you very much for your attention, and we'll see you next time. Thank you. สวัสดีครับ
กราบขอบพระคุณค่ะท่านณัฐพานุนพคุณรองอธิบดีกรมสารนิเทศและรองโฆษกกระทรวงการต่างประเทศนะคะสำหรับการแถลงข่าววันนี้ส่วนช่วงของรายการสนทนาตอน 14 นาฬิกาหรือว่าบ่าย 2 ของวันนี้ค่ะคุณผู้ชมสามารถติดตามได้นะคะเป็นเรื่องที่ใกล้ตัวมากๆเรื่องของสมุนไพรไทยกับการดูแลสุขภาพสร้างภูมิและเตรียมพร้อมรับวัคซีนโควิด -19 สมุนไพรที่มีอยู่ใกล้ตัวเราจะใช้ในการดูแลตัวเองอย่างไรนะคะเป็นการต่อสู้กับเรื่องของโควิด วิด -19 และเตรียมพร้อมร่างกายที่จะรับวัคซีนในช่วงปี 2564 นี้สามารถติดตามได้นะคะไม่ว่าจะเป็นทางช่อง 2 HD หรือว่าทางเพจ Facebook Live NBT 2 HD ค่ะทั้งหมดนี้ก็คือการแถลงข่าวจากศูนย์บริหารสถานการณ์โควิด -19 จากที่ทำเนียบรัฐบาลดิฉันปวีณา ฟักทองพร้อมทีมงานลาไปก่อนนะคะสวัสดีค่ะ